Hello. Today I want to share with you a methodology of learning how to make diagrams and illustrations. You need to make these diagrams and illustrations sometimes in your exams to make your answer look more attractive and comprehensive. But later in your life, you will need these diagrams and illustrations to explain to your patient what he's suffering from, what is his disease, what will happen if he doesn't get treated. So you need this skill. And this skill of making diagrams will not come to you in a day. But I can rest assure you that if you learn this skill well and you practice it now and master it, it's going to stay with you for the rest of your life. It's like learning to ride bicycle. You learn it once and you know it for the rest of your life. Same way, if you know how to draw an illustration and you get a basic skill for it, it will be handy for you in all your life. And mind you this, that patients get hugely influenced by your ability to draw the disease process the patient is suffering from. He thinks that you have understood his disease completely, and it helps to build the confidence between you and your patient. So this is one of these soft skills or motor skills that you need to go about. Now let me try and tell you what I was just saying, that you learned this skill once and stays for you rest of your life. When I was studying anatomy sometime about 30 years ago as a student like you, I learned making skull. And see, I can draw the skull anytime. And I'd like you to see how we draw and see the concept and see what to draw first and what to draw later. This is very essential in undertaking making illustration. Now this is how it looks like. Looks like this. Like that. You draw here. Here. See what you need to draw first and what you need to draw later. You have to also keep in your mind the proportions of the structure. You have to keep in mind the shapes of these structures and the proportions. And then you have to just go like that. That's the right process. How long does it take to draw this? If you know how to draw it. This is the teeth. Draw the teeth also. You have to just keep in mind the proportions. Right? It takes few seconds. You can also draw, some sutures. Tedion. And when you're drawing it, these sutures are not very prominent, so you can draw them here. But these sutures are more prominent. So you draw them a little thicker. So that's what it is. I learned this 35 years ago and I draw it even today, if need be. And I learned this there and I used it for showing Leaford fractures in maxilla. I use it for showing temporomandibular joint. I use it for showing muscle action or mastication. So many places. So once you master this skill, you can use this at any place that you want to. I want to share with you how I learned making the illustrations, and you should also try and copy the same skill. What you actually need for beginning. What you need is, I think, if you ask me, first thing you need is the power of observation. You have to build in you an intense observation power. Whenever you see a structure or a disease organ, you should be able to observe intricateness of that organ, of the disease. So your power of observation is very essential. You should be able to develop in your mind the imagination. Suppose you think of the urinary bladder, because I'm a urologist, so I'll be sharing with you urology illustrations today. So if you think of urinary bladder, you should think in your mind, how does it look like in anatomy, actual anatomy. And then if you think of the new disease in the bladder, say cancer bladder, how does a cancer bladder look like? So that should be the observation and imagination are needed for giving you a concept. And having had that concept, you have to have with you basic illustration skills. You don't have to be, very big draftman. You don't have to be really very big artist, but you need some fundamental skills of drawing illustrations. And be little particular on those skills. Say what? You should first of all have a capability to draw, lines parallel to each other, like this. Or when you draw a curvature, the another line should follow the same curvature. See, like that. Like that. The another line should follow the same curvature. If you draw this way, you should be able to draw another line parallel to it this way, the same size. So you learn to practice two parallel lines in different curvatures. Next, you should be able to draw a shape. If you draw one, you should be able to draw the same all over again. And you should be able to draw the same all over again. Because in exam, you sometimes need to draw 2-3 diagrams together. And your 2-3 diagrams should look similar. So you should be capable of drawing nearly same shapes, right? And in that shape, you will need to hatch sometimes. And when you hatch sometimes, don't do like this. Or don't do like this hodgepodge. This is no hatching. This is not shading. You have to be little particular in hatching. And particular means if you have to draw oblique lines, begin from one point and go to the other. Begin from one point, go to the other. Begin from one point, go to the other. Don't cross the limits. That means don't cross, right? Just keep drawing, and you need this practice to be able to draw these lines parallel so that your hatching looks fine. Right? You can just draw this, and if you practice, you can be fast. You can be fast like that. The distance between the two lines should be the same. The difference is obvious. You also try to learn the skill transfers. Two lines transfers. And you do two lines transfers, same principles, straight lines. And this will take you many years to learn this, drawing two lines parallel and drawing, this is what I say, draw parallel lines to hatch. If you get this skill, you will use it a number of times. So that's one, how to hatch. Second is, you should know how to put dots and shades. If you draw these two shapes, these three things, and you want to show some dotting into this. Don't dot like this. This is also dotting. But when you dot like this, you will see not all dots are of same shape. The distance between the dots is not same, and that doesn't make impact. So instead, what you should do, you should dot everything of the same size in the one line. First, same dots equidistantly placed, and when you draw next line, try to dot this one. See, in between the if these are two dots, the lower line dots is here. Here. Just place the dots like that. Just place the dots like that. If you place all dots of same size and the distance between the dot is kept uniform, it has a different impact. Like that. You can be faster with this. With practice, you can be faster with this style. Also, you can see the difference now between this dotting and this dotting. You can also use this dotting to show the differential layering, and you sometimes need to show body fluids. Say for instance, here the distance between the dot is more. This is the dotting here. As you come to next layer, make these dots look closer. They come close. They come close, right? When you come even lower, make them even closer. When you make them closer, you are trying to show, make them closer. And you can still make them closer. If you make them close, you are trying to show the differential layering of body fluids. See, that's what. So this is what you need. You need just this basic skill set to begin drawing illustrations for an exam and also for your patients. Now let me show you today about how to make illustrations for various diseases in the lower urinary tract. And in lower urinary tract, the commonest disease that you need to know about, or you may need to talk to your patient about, is the prostatic enlargement. Okay, so I'll first show you if you were to do this in exam. I understand that your examination pattern is gradually becoming more multiple choice question type, but it's not the same everywhere. You may be using MCQs for undergraduation, but soon you move to different level of medical training. It's not same everywhere. So please don't give away your skill of synthesizing a paragraph and drawing an illustration. Suppose you were to draw for the prostate. First you draw a basic diagram of lower urinary tract, and this is the bladder, and this is the prostatic urethra, sphincter urethra, and that's how it goes. The bulbous urethra, right? And here is the prostate. this is a basic diagram of the lower urinary tract. Bladder, prostate, sphincter urethra, bulbous urethra, penile urethra, and the fossa navicularis. You can draw an outer layer to show that there is a muscle here. And you can draw another parallel line here to show the outer layer of urinary bladder. And this implies the thickness. So this is a basic diagram. When you draw this diagram, you have to keep in mind the components and the relationship of the components and the size differentiation between the components. This is bladder size, this is the prostate size, this is the urethral size. They look this, that's the way it should be. Now you want to show what happens when prostate enlarges. You know that the bladder becomes larger. So you draw a larger bladder this time. And you know the prostate bulges inwards and the urethra becomes narrowed because of the compression by the prostate. And this is the enlargement of the prostate. And then this urethra is not influenced. So you go down there. And this is the bulbous urethra. The prostate enlargement. But then when the prostate gets enlarged, the bladder is using more force to contract, to push the urine across this narrowed urethra. The muscle of the bladder undergoes hypertrophy. And you want to show now a thickened urinary bladder wall. So you show thickened urinary bladder wall. Like that. Thickened urinary bladder wall like that. These are the trabeculations, circulations here. So this is the next step. When the prostate enlarges, what happens to lower urinary tract? You want to see more complications? And draw a third diagram, and you know bladder enlarges more. And the prostate is grown more inwards. That's how the urethra is, the narrowed urethra, and the prostate is like this. This is intravesical enlargement of the prostate. And the urethra remains the same. In the bladder, which is trabeculated and circulated, which you draw like that, sometimes what may happen is that you get here what is called residual urinary volume. And in the residual urinary volume, you need to show that the bladder is filled with urine. And see that we're doing this dotting concept. There is some urine left behind in the bladder every time the patient voids, and this is residual urinary volume. And in this residual urinary volume, you can make dots closer as you come towards the bottom. You can make these dots closer as you come to the bottom. So this is the residual urinary volume in the bladder. In this residual urinary volume, because of stasis, the bacteria grow. And you show this bacteria. In this residual urinary volume, the stones develop. And you see stone here. And you see, you can use this concept of hatching on the stone. The stone has developed in the bladder. some patients develop what's called, you see, some patients develop here a diverticulum. They develop here a diverticulum which goes out of the bladder, behind the bladder, like that. This is the diverticulum of the urinary bladder. And this thing continues in the diverticulum of the urinary bladder. See, this is urine. You can do this same thing again. And you can actually be faster. To show that this is a diverticulum formation in bladder as a result of a distal obstruction. Right? So this is, you can actually make this faster. So that's what it is. Now if you see these three stages: normal bladder, enlarged prostate, trabeculated bladder, stage of compensated obstruction. Now the complication is taking place, stage of complication in the bladder. And now you want to label this. A labeling and illustration is also something which you need to pay attention to. You don't do this, that suppose you want to show thick bladder, thick bladder. You want to show bacteria, bacteria, stone, stone, diverticulum, diverticulum, prostate, prostate. And this is a hodgepodge. And you label here detrusor, thickening, like this. And you write bacteria, oblique, and write calculus. And you write here diverticulum. And you write here prostate. You can do this. Some people do this, in fact most people do this. But that's not the way I want you to do. I want you to do this, to learn this little proper, so that it looks impactful. It looks impactful. See, you rub this off and not follow this, what I've shown you here. Not follow this one. Okay. So I'll remove this. Okay. And I'll remove this. I don't want this kind of illustration drawing. What I want you is, if you were to draw, okay, I'll rub this off to create some space for you. When you draw something, draw a straight line. The detrusor, the bacteria, the prostate. If you have to draw for the stone, take it like this and then convert straight. Okay? If you have to write for prostate, write for prostate. The lines that you make should look parallel, and then they should end at an equal distance. And then you want to write here, write neatly, detrusor. Write here, bacteria. When you write, the text is also should be straight line. Median, low. Prostate. Write them straight. Calculus. Instead of writing oblique, write straight. And if you were to write here for this, diverticulum. Write straight. And what you can also do, If you actually want to highlight what you did, you can make a box over this. When you draw a box, be sure of your lines. Don't make a hodgepodge box. Make it right rectangle. The text that you wrote should be in the center. That's the way. So the illustration is important, the way you label is important, the way you write, what you want to write is also important. It will not take you long to learn to do this. So this was what I showed you to when you have to make for the prostate. Now suppose you want to now show what happens to the upper urinary tract. Upper urinary tract in the prostatic enlargement. So same thing. This time you begin a little smaller version. So you want to make a focus on the upper urinary tract. It's a smaller version of what we made earlier in the prostate. And then this is the bladder outline. You can always make these small lines go nice. And this is ureteric orifice, and this is trigone of the urinary bladder here. And you want to now show the upper urinary tract, so you go like that because it's behind the bladder, and then you make the upper urinary tract. The ureter below is thinner. As you go above, it is slightly thicker. And then you see the kidney and the calyces. Okay? The same thing here. This is the urinary tract below. So you draw, you can draw like this also, upside down. Upside down. And go 1 calyx, 2 calyx, 3 calyces, and you come and here. And this is one kidney on the right and the kidney on the left. When you draw left kidney, please draw dromedary hump. Dromedary hump. Left kidney looks slightly different than the right. This is the normal urinary tract. When patient's prostate enlarges, the bladder becomes bigger. Remember, I showed you bigger bladder that time. Bigger bladder. The prostate is bulging and is occluding the prostatic urethra. Bulging. The bladder wall is thickened. Okay. See, you can draw parallel to previous lines. And this is what the urethra is. And drawing bulbous urethra, a little more capacious. And this is the trigone here. And now, because of the obstruction and because of the backflow, the ureters tend to get dilated. When you show dilated ureters, you show them like that. And these are dilated ureters. And the kidney is also having dilatation of the calyceal system. And the kidney is also becoming uneven. Right? Same thing. You can draw here. The ureters become dilated and tortuous because of the hydronephrosis. Because of hydronephrosis, the calyx get dilated, the kidney becomes larger, and this is what's called from normal urinary tract to a dilated hydroureteronephrosis. Next, what will happen if patient is not careful, and you know what happens, the patients can develop a state of what is called chronic urinary retention. Bladder is really big, the prostate is big, this is the urethra here, and this is the outer line of the bladder. And this is the trigone. And then what happens is that these ureters, which were dilated and tortuous, the kidneys, this is a dilated tortuous ureter here. This time what happens is the parenchyma becomes really very atrophic, and this is because of the loss of parenchyma. In loss of parenchyma, you can fill the color. You can fill the color to show that the parenchyma becomes thinner, and there is atrophy of the parenchyma. This is a stage of chronic urinary retention setting in because of a state of chronic urinary retention in the bladder. You can draw similar kidney on the other side. Similar kidney on the other side. When you draw on the other side, see that you should be able to draw something similar looking, like that. Draw something as if it's a mirror image for the opposite side. Dilated tortuous ureter and the kidney like that. You should look mirror image. See? Mirror image, what it is here on the other side. So you have to practice this mirror imaging when you draw something similar on the other side. You can shade it. So this is a kidney damage that's taking place as a result of the renal failure, as a result of a back pressure. In some patients, the bacteria can ascend up because of reflux, and they go up and they cause an infection in the kidney urine. This is infection taking place here, and the urine is actually becoming loaded with bacteria, and this is a pyelonephritis setting in on the right side. So you can depict. Now when you have to draw these illustrations in an exam, I would advise you to draw 1, 2, 3, right? Because then you can compare what is normal, what is little ahead, and what is more advanced. But when you are actually showing to a patient, you can draw one over the other and do layering. When you draw one over the other, don't mess up. Don't create a hodgepodge thing. Be neat, be clean. So this is about drawing what may happen to the patient following prostate enlargement. I hope I'm making my points clear to you, and I'm showing you what are the details to which you should pay attention. Let's see the other disease of lower urinary tract and what you make in that. At this time, another common disease is urethral stricture. For urethral stricture, again that standard prototype diagram of the lower urinary tract. But this time you need more focus on urethra because you are showing a urethral disease and the prostate and the bladder You also need to draw here ejaculatory ducts and the seminal vesicle. And you need to also draw here the vas deferens and the testis and the epididymis. And this time maybe you need to draw a bit of a penile outline. Outline of the penis and maybe outline of the scrotum. Adding a little more complexity on the base diagram now for you. And this is a normal arrangement. Why have I drawn testis, epididymis, seminal vesicle over the initial format? Because now I want to show you some changes that will take place in these adjoining organs. When a patient is normal, this bladder is contracting, the urine empties out of this patent urethra and comes out in form of a urinary stream. But when patients develop the bladder, the prostatic urethra, the prostate, okay, and this is the bulbous urethra. In the middle of the bulb, the patients can develop a stricture. This is normal urethra, and this is the area of stricture here. When stricture occurs, the urethra proximal to it gets dilated because urine flows into this, and the bladder muscle is using pressure to empty urine against obstruction. So the whole urine comes through this passage and comes and meets the resistance here. So consequently, this urethra gets dilated and starts accumulating some urine behind it. This is what is happening in the stricture. When strictures get complicated, what will happen may be that the patients develop a state of urinary retention. When there is a state of urinary retention, this is the prostate here, and this is the stricture here, and the stricture gets completely occluded, and it's because of the edema completely occluded. This is open, completely occluded, and the bladder muscle gets stretched, become thinner. This is a stretched urinary bladder because of the retention. So what you got actually here, and you want to highlight what happened, you can draw here an arrow of this type showing that there is a total occlusion here, and you can draw arrows here showing that the bladder is expanding beyond a limit, and this is a state of urinary retention which happens because of the chronic obstruction in the urethra here. So from partial obstruction, it gets converted to total obstruction, and patient develops urinary retention. So this is what I would call uncomplicated urethral stricture, and this is what I would call complicated urethral stricture. Now more things can happen to your patient, and we retain this base diagram. What may happen that in this patient, because of the pressure here, it may rupture from here and an abscess forms, and patient will get a swelling in his penis. This is penis, and on the undersurface of penis, patient develop a swelling. This is scrotum. And again you want to show that something happened here and which is painful swelling. This is a periurethral abscess. You can fill inside the pus. So this is one complication that happens, the periurethral abscess. The patient can develop another complication here, and that is that the abscess ruptures outside behind, and this urine now gets extruded from here. What is this? This is a periurethral abscess, and this is a periurethral fistula. And you know these are complications of urethral stricture, right? You can have another set of complication, and if I were to draw, again similar thing, the bladder, the prostatic urethra. See, when I draw prostatic urethra, I create a little bulge here in the center, and this is the prostatic urethra. That's the way it looks like. And drawing this is a dilated bulbous urethra now, and this is normal urethra. Here, what will now happen, because of the pressure of the bladder, pressure of the bladder, urine comes here and meets the resistance here. So with the result, there is occurrence of positive pressure in the urethral lumen, and this positive pressure goes upwards in the prostatic urethra here. So this segment of urethra is actually under pressure. So with the result, the urine flows through the ejaculatory duct. Urine flows through the ejaculatory duct. Urine flows through the ejaculatory duct. It goes into seminal vesicle, which then gets swollen up. Right? And when it gets swollen up, it forms into this many areas of small abscesses or areas of bleeding, and that's what is called seminal vesiculitis. And there can be hematospermia from the seminal vesicle. This is because the pressurized urine, infected urine going back in seminal vesicle. Okay. You can have this so-called backflow into the testis and epididymis, transvasal, through the vasal, and the testis may remain the same, but the epididymis actually gets swollen up, and patients they are okay with the penis, but then in the scrotum they get markedly enlarged swelling. There is swelling of the scrotum this time. One side testis and one side epididymis is swollen, and you want to show this with diagram. This is swollen. So you see what? A normal urinary tract, complications in the urethra because of stricture, and complications in the adjoining glands because of stricture. periurethral abscess, periurethral fistula, seminal vesiculitis and epidermitis. You can even show the abscess forming in the epididymis. This is the abscess which is forming in epididymis. This abscess sometimes ruptures outside and can even form a scrotal parietal abscess. The point I am trying to make is, as I said in the beginning, you should have in your mind an imagination, a concept, a skill to draw, and you can create wonders in your answer books. And you can actually, if you draw this freehand, you will impress the patient hugely. I hope I have been able to communicate to you what you need to draw and giving an example of some common diseases of lower urinary tract, the prostate and stricture. I hope to meet you again with showing you how to make illustrations of diseases in the upper urinary tract. Please develop this skill. It is not difficult, and take it from me, if you draw this in front of a patient, it is extremely reassuring to the patient. Thank you very much for your patient watching. Bye bye. Have a good day.